Hello everybody, Wayne Pyle, West Valley City Manager here today with Chief John Evans to talk about upcoming vaccinations for the COVID-19 pandemic. First thing I wanted to ask Chief Evans is, we've all heard sort of the national stories about the vaccines coming and who's going to get it first and where and all that sort of thing. What are you hearing in terms of for us here at West Valley?
Well, you know, the state has a three-level process. Right now, the two vaccines that are here are the ones that were approved, Pfizer and Moderna. In the phases, the healthcare workers are one of the first priorities, along with some of the long-term. Then it goes down into some of the first responders, some of the people who are more vulnerable, and then it comes out to the general population. As has been said, they're hoping and they're thinking that by summertime, the vaccine will be available to everybody. There will be enough doses, everybody can get it.
Okay, and here, specifically in Salt Lake Valley, and maybe by extension West Valley, we're already seeing healthcare workers get it, right? Do you know, like, how many?
The hospitals, the first few hospitals have started to get it. Now they're moving into the other hospitals and healthcare workers. We've heard that some of the first responders could be getting it as soon as January, February, and then it'll go from there. As the doses come out, both the state and the county are doing the priority list, which includes, like I say, first responders, teachers, some things like that.
Okay, great. So, Chief, when the vaccine becomes available, how will people actually get it? And will it cost anything? Where are they going to go? How will they actually get it administered?
Right now, for the general public, they're looking at some of the pharmacies doing it. That's how it will get administered. As far as the cost goes, there is no cost for the vaccine. If you were insured, there could be a small cost for just maybe some administering of the vaccine, but for no insurance, there'll be no cost. That was one of the things they wanted to make sure, is that if you wanted the vaccine, you could get the vaccine.
So I want to emphasize that. You're saying if you don't have insurance, there will be no cost.
That's what I've been told.
Okay, very good. And if we have insurance, there might be some sort of administrative cost, but it would be minimal. Are you talking about on the level of like a copay or less, or what?
That's what I would assume. The vaccine is not the cost. It could be some of the administration of giving the actual giving of the shot.
Right. Okay.
Is what it would be.
Okay. So, what is this we're hearing about the 2-dose thing? Is that real, or is everybody going to be getting 2 doses, and how would that work, or not? Are there other options?
Right now, the 2 vaccines that are out, there is a 2-dose. You get the first dose, and then you get a booster 28 to 30 days after. That is how the vaccine is working, how it's working with your body and the cells. So right now, all the vaccines are a 2-dose. There is talk that there is one manufacturer that could come out with just 1 shot, but that has not been approved. Okay. So right now, everybody will, when you go in for your first shot, they will tell you when you need to come back within that time frame to get your booster shot.
Great. So I also understand that there are some segments of the population that, at least right off the bat, the recommendation will actually be that they don't get the vaccine. Can you talk about that a little bit?
It has been out there. They have talked about some of the things with allergies. If they've had, you've had severe allergies, what they're saying is you should always contact your doctor if you're worried about it. Yeah. If you're pregnant, contact your doctor. Anytime, I guess it's like anything else. If you're worried about getting any type of a shot, whether it's the flu vaccine or this, and you're worried about it, probably the best thing to do is to call your doctor. They're the ones that are going to be able to tell you, yep, go ahead, no problem, or hey, no. So that would be, a suggestion that throughout all the studies, this has been pretty successful as far as some downsides of it. But they've always said, and the CDC has said, and everybody else, if you've got some deep questions about some of your allergies and things like this, contact your doctor.
You know, I think that's great advice in any event anyway, and especially if anybody's going to have any concerns, and there probably are some legitimate concerns about how and when and whether you should get the shot, it's always good advice to call your doctor, right?
Yes, yes.
Very good. Okay, well, what about in the meantime until the vaccinations become available? What should we be doing?
You know, here again, even as the vaccines come out, everybody's not getting them at the same time. So everybody still has to be very careful. Even those who have the vaccine, you still should wear a mask. You still should social distance. You still should wash your hands. This is going to take some time for everybody to get vaccinated and for this to somehow fade off into the distance like some of the other viruses that have happened. But in the meantime, you know, the only thing I'd suggest is don't let your guard down. Wear your mask, distance yourself, watch what you're doing, wash your hands, just follow the guidelines that, you know, that have been out there. You know, and they're good guidelines, washing your hands and stuff like that, even if there wasn't, you know, flu season. So, you know, the best thing to do is just keep doing what you're doing and, you know, watch for some of the media, watch for some of the stuff from the CDC, from the state, but don't let your guard down just because the vaccine has started.
Very good, great. Okay, thanks, Chief. And for all of our viewers out there, you know, whether you're finding us accidentally or whether you're a member of the West Valley community, I'd like to also just note something else. A lot of times in government, we are accused, sometimes fairly, sometimes not so much, of trying to impose or give an answer that, you know, in a one-size-fits-all sort of a scenario for everybody. And we recognize we have lived through this pandemic just like everybody else here, and we know that success in fighting this pandemic, this virus, is a multi-layered thing, you know. So a lot of times the answers to everybody's individual circumstances are going to be a little bit different, whether that's avoiding the virus now, whether that is dealing with post-life after having gotten the virus, or whether that's making the decision when and how to get the vaccine. But we definitely encourage everybody to be wise, investigate what it is that you might have any question about, whether it's the vaccination, whether it's current treatment, whether it's symptoms you might have. Because in the end, all we're really trying to accomplish here is to get everybody through this safely and whole. And be assured that here at West Valley, that's exactly what we are going to gear our efforts towards. We are planning on coming back and doing some more updates on the vaccination process itself as it comes along, as it becomes available, and as situations change. And with that, thank you all, everybody. Have a great day and stay safe.